Just in time for a conversation with Governor of Machakos, Dr. Alfred Mutua is joining us via Skype from Machakos. Thank you so much for making time for us, Governor. So, salama sana, my friend. So, quick question. On the 18th of March, you said that the counties are ready to start testing for coronavirus, but you are waiting for approval from the national government. Have you gotten that approval?
No, we've not gotten that approval. Actually, we're quite disappointed because we have actually ensured that all our lab equipment is functioning. We've ensured we have everything in place, and Cambry has been saying that they are going to send some experts to come and look at our capacity and everything so they can approve us. But up to today, we've not had a single visit. We call them every single day, but they may be overwhelmed, so we're still waiting.
What is the explanation for the delays, Governor? Because this would go a long way in helping the pressure from the national government.
I think it's basically the sickness that we have in this country of centralization, where we try to centralize everything until it's a matter of no return. So wakati tafika, wakati wa panic, kumeharibika, kumedhoka, ndio tunaona wamekimbia wamekuja Machakos. So we don't seem to think about planning ahead. We wait until it is last minute and then we respond. It's a Kenyan culture that is quite unfortunate.
Governor,
so what we are giving them, we're telling them, come early, let us be ready just in case. Lakini watangojea mpaka ilipuke, ndio watakuja sasa hiyo back and forth, we lose 3-4 days, hii equipment haiko sawa, hii reagent haiko, tufanye hivi. At that time people are dying. So it actually makes me very angry.
So speaking of kujipanga, Governor, what have you done yourself as the Machakos Governor for the people of Machakos?
Well, we already have 69 isolation beds in 3 different centers.
Okay.
We have ensured that our health workers are protected. We don't have enough PPPs, but we have been getting some from the national government. We're already in the process of procuring. As you said earlier on, we've set aside 100 million from our health budget just to deal with coronavirus issues, COVID-19 issues. And basically, we've been a bit tough in terms of ensuring that we prevent any what they call community spread by ensuring that people are not squeezed together, people are adhering to the laws, and we are sensitizing our people.
Yeah, you have banned the use of border borders in your county. The government says that they should just carry 1 passenger and wear masks. Are you willing to reconsider this position?
Yeah, we reconsider because we need to be aligned to the national picture. So when the national government say they carry 1 person, we told them, okay, you can get back on the road, you carry 1 person, but they have to wear a helmet, they have to wear masks.
Yeah.
And also we extended tuk-tuks also, tuk-tuks to carry 2 passengers sitting far apart. Then we've got those small matatus called marutis here in Machakos, where they usually carry 7 people. Now they'll be carrying 4 people, including the driver. So 3 passengers and the driver.
All right.
And then we have a lot of buckets, a lot of tanks. The private sector has come in and donated water tanks across the whole county. So people are washing hands, people are cleaning up. We have sanitizers that we've gotten from our friends, and including the national government, and we're procuring for more. So in other words, we are ready. But my biggest fear is imported coronavirus to Machakos.
And what is the plan for that? Are you checking people at the entry points in Machakos? How are you trying to deal with the imported cases?
That is where we're going to next. We'll be holding a meeting today or tomorrow with the emergency task force in Machakos, and we are thinking that very soon we may have to put, you can't be called them border controls, but controls on all the entry points into Machakos so that we can test people. Whoever has a temperature, you go back. But you know, that is not an adequate test because you may not have a temperature, but you may be infected, and the temperature will come 3, 6, 7 days later when you're already among us.
Yeah, but Governor, even as you put up those plans, 720 youth were in Manzoni Lodge, which is in your county. They were meeting there despite the government specifically saying people should not meet. Are you aware of this meeting?
Well, we were aware. When we were not aware of it before, but as soon as we got wind on their day 2, day 3, we moved in yesterday. We closed the facility. We arrested quite a number of people. But it is madness. It is pure madness. I mean, look at it this way, Trevor.
Yeah.
We have banned people going to churches. Churches as small as 50 people. We've banned all these small churches, 100 people from going. Our funerals are only being attended by 15 people. Only 15 people. Yet somebody in their own mind organizes innocent 720 young, poor men and women to meet in a gathering that has already been banned by the President and the Minister of Health to discuss, I believe, I don't know what, politics, 2022 preparedness for presidential candidatures and all that. That's what we're hearing. You know, it's madness.
Governor,
this is greed at its utmost.
Yeah.
These are people who are so greedy to continue with business and make money and prepare for power while risking the lives of Kenyans. These are nothing but murderers.
Governor, you call it madness, but many people would say it's a failure of the system in your county. We should have identified that there was something wrong going on and stopped it before it even happened.
Well, they came in. You see, these are private institutions. They came in day one. Day two were alerted. By that evening, we had already moved in. So it is not about a failure. It's about we responded immediately, but they had already spent a night there, you know, because people can walk in and out of hotels. Yeah. You know, hotels are not closed in this country. So people are walking in, getting a room, you sleep in a hotel, you go. But when it occurred to us, all of a sudden there's a massive number of people in one particular hotel. We moved in. We found that people were sharing, 2 people were sharing a bed, a room, others a bed. And I mean, there is no separation there at all. Some of them are total strangers. And I think it is a total disregard of humanity by the people involved, because the government cannot be everywhere. That's why we are calling for personal responsibility.
Okay. What is the missing link here? Is it the sensitization that is not being done appropriately, Governor, or what is happening? Because you say that you've informed your people to stay at home, but there are meetings there.
Well, these meetings are not from people from Machakos. Okay. These are people brought in from Nairobi and elsewhere. So this is not my people of Machakos who have not been sensitized meeting there. And it's actually the people who told us are the people from Machakos who work there, who alerted us about what was going on, because they have been sensitized. So these are an organization linked to, I don't know who that brought these young people from all over the country.
Okay. And now, is there a chance, Governor, because most people are wondering, are you going to give relief food to your people when the rubber meets the road? Because now there's a lot of economic impact. Is there a plan for that? How much have you set aside?
We will. We're looking at it. The good thing is that due to agriculture initiatives and the water programs, Machakos is not serving. And we've just given free seeds of ndengu, beans, and others to our farmers, especially the ones who are quite poor. We've been plowing for our farmers. We've got our 40 tractors plowing that has continued, and have been urging our people to get to the shambas and dig. We still have food in our galas, but in 3 months, unless we are harvesting, it's going to be difficult. So that is why I've been telling people, stay at home, uko ushago, uko nyumbani, uko mashambani, lakini usikae kwa nyumba tunasikiza redio, toka kwa shamba, tulime, tupalilie, tupande. So that within 3 months, when there is a shortage of food, you will have food in your house, so that what the government will be doing is supplementing.
Okay. Governor, are you satisfied with what the national government is planning? Because on the 18th of March, you said that there is more that needs to be done, especially to cushion Kenyans of the economic impact.
I want to congratulate President Uhuru Kenyatta for the measures that he undertook. He was working from a negative because his finance ministry had already been messed up. I mean, the budget had been overblown, you know, with maybe a whole of, I estimate from where it sits, 350 to 400 billion shillings that we don't have, but are already in the budget. He's got issues of corruption. He's got issues of inefficiency and bureaucracy, a slowdown in the growth of the economy. So he was trying to put measures that would also ensure that your cushion salaries can be paid and others.
Yeah.
But I think what is important is to support the private sector, because the private sector is the one that's employing people.
Yeah.
And one of the initiatives that I thought he would do was to ask the banks to waive the payment of loans for several months. Because look at hotels, for example. Look at service industries. They are basically shut down. Transport industry, they're shut down.
Yeah.
And the bank is still expecting you to service a loan. How are you going to service that loan? The only way to service that loan is to send people home because you're not making enough money. So you're creating poverty and creating hunger. Because if people do not have money to buy food, then we have to feed them. So the cost is even higher.
What about the rent, Governor? Because most people are wondering the end of month is coming. Where do I pay? How do I pay my rent? Some of them have had salary cuts. Some of them don't have jobs. What do you think should happen in terms of rent?
It's a catch-22. I think he needs to ask our household owners. Basically, we need to ask our landlords, please go easy on the rent. The big ones, the ones who have many houses, they have money, they can even forego rent for several months or even reduce rent by 50% or 75%. There are others who are small ones who just live on that rent. You've got widowed families. You've got a widow who has 4 houses and that's her income. So telling her to forego the rent is also a problem. So it's a balancing act. But the ones who can afford can actually reduce. We can start by reduction, telling people 50% or 75%.
Okay.
And then we're moving from there. Because also there are people who are still working.
Yeah.
There are people who are still being paid. And if you say they don't pay their rent, also that slows down the what is called consumer spending because money is not circulating in the economy.
Yeah. On the 19th of March, Governor, you said that this disease is an opportunity for Kenyan leaders to learn. And you're actually happy that all of us are locked in here. What did you mean exactly?
What I meant is this. If you go to a public hospital in Kenya, when I took over from Machakos, I could smell the maternity, the placenta, the blood from the placenta of the maternity 150 meters away. 150 meters is a long distance. That's 100 meters, Kameli 100-meter dash, plus another 50 meters. You could smell the hospital. It was dirty. When I go to that hospital, there was blood everywhere. We have cleaned the hospitals. We have cleaned our health facilities. We've given hot water to pregnant mothers. We are putting hot water in all the wards in Machakos County. We want to make sure that all our wards will look like wards in a private hospital as they do in the West. So there's been total neglect of our public health facility because they serve the poor. And basically what I was saying is that we as leaders need to realize that now, unless we support our health facilities, unless we support our doctors and our scientists, when things like this happen, then we also suffer. Because we live in Kenya, nobody's going to accept you in India. India was the first one to lock up. Nobody's going to take you to Italy or the US or England to be treated. So, lazima daktari wetu wakue chap. Lazima daktari wetu wakue the best in the world. Our labs have to be producing cures. So we cannot be depending on any other person. So in other words, it's a wake-up call to say, Kenya, take care of your business because there's nowhere else you can go.
Speaking of taking care of business, Governor, I want to take you back to something you said annoys you so much, the centralization of everything. What is your testing capacity right now? If you got the approval from the national government, how many tests can you do in what span of time for coronavirus?
We believe, it's all about, each test takes about 6 hours. So it's about manpower. We have equipment. We can test just as well as Cambry with the same speed, 50 to 100, 200, depending on the reagents and the number of staff that we have. So what we'd like to see is a partnership where we've got our lab assistants and our lab technicians partnering with the ones from the national government and working together.
So right now you're saying you can test between 50 to 100 patients within a span of 6 hours?
Within a span of 6 to 12 hours, we can be able we can move at the same speed as the national testing centers. Because the equipment that we have is exactly the same. No difference.
Yeah.
Exactly the same.
So I'm still curious and wondering why you haven't gotten this approval, Governor. You have the benefit of calling even the highest in the offices. Why is this taking so long?
I think they're overwhelmed. They mean well, but they're overwhelmed, and they have not really, nobody there is thinking decentralization yet. I talked to the minister. I had a chat with the CAS. I've talked to the Cambridge professor. They keep on promising they're coming. So we hope they'll come today.
Okay. And so you, on the 19th of March as well, Governor, you said that we have to have a balancing act. Do you think a shutdown will be balancing our probabilities of beating this virus?
Well, we'll have to prepare for a shutdown. Because what I was saying is that you cannot do an immediate shutdown because that would cripple the economy, people would starve, you'd have a lot of violence and other things. But see, it's about working us towards that. And I think the president, in his wisdom, I think it's very clever, started by the curfew. So my next step, if I was head of state, would be to extend the period of the curfew. So you extend it to say curfew starts at 5 p.m. to 8 a.m. Eventually you do curfew starts from 10 a.m. in the morning to 3 p.m. It's basically partial lockdown. People start realizing that they need to stay home. And then eventually you push it to a shutdown.
Yeah.
And then watu watajipanga, watakuwa na chakula cha kutosha, watakuwa wamechanga-changa, wameongea na neighbors, so people will get to that. But if it gets to massive community spread, Kenya will require a shutdown. Will require a shutdown, even if it's for 2 weeks or 3 weeks, whereby you stay within your compound, within your house, you don't move out, and then we will have to move door to door, testing people even for temperature in all our households, and isolating people who have any signs of COVID-19.
All right. Governor, if that shutdown was to happen today, now that you're speaking of Kujipanga, and you said you're thinking of having relief food for the people of Machakos, how much food reserve do you have right now? And would you do this door-to-door like we've seen in Rwanda by President Kagame, who's distributing food door-to-door, supervising it himself?
You see, let's be realistic here.
Yeah.
You cannot give food to everybody. You give food to the needy.
Okay.
There are people whose fridges are so stocked up, they can feed a whole village for 2 months. No, you know, mtu mmoja, nyumba moja. So why is the government going to feed them?
Okay.
And there are people who have nothing at all. Those are the people we feed. So what we're doing right now is quantifying the needy. There are people who have been in the villages, we've seen, who their galas are already full with maize and beans and dengu and vegetables. They already have food. So we feed the vulnerable and we share the little we have, then it's able to go. So you don't just feed everybody. You feed the ones who have the need.
All right. Governor, before I let you go, what more options are you looking at for the people of Machakos long term? Because we seem to be fighting this pandemic for a while.
I think we'll have to change our habits. We've been sensitized. We'll have to change the way we relate with other people. I promised my people that I'm going to make Machakos a center for proper healthcare, so that even in the future we can treat our patients. We are getting more ventilators. We've gotten people from the private sector who are talking to me, who even want to donate ventilators. And so we are working on making sure that our hospitals are always ready. I just pray to God that we don't have what we'd call a pandemic in Kenya. We have an outbreak now. We don't have a pandemic. So I hope Kenya will not get to the stage of a pandemic. I think the temperatures are helping us. We moved fast, and I thank the president and his government for the speed that they moved in. We moved fast as counties, and we hope that we'll be able to contain it, and we pray to God that we're able to contain it.
All right.
But our people have to realize we have to change our habits.
All right.
There's an issue I talked about yesterday at Rwanda, and that is I challenge and I continue to challenge our scientists, our professors, our PhD holders, our research assistants. We need to come up with a cure for COVID-19. We shouldn't just sit and wait for a Chinese or an American or a European or an Australian or a South American or a South African to come up with a cure. We have very educated people. You go to some of these universities, you see the diplomas on the walls. You'll be shocked. So what are they doing? They should be in their labs right now, mixing things, trying to come up with a cure.
Yeah.
Others are arguing they don't have the funding. But I mean, how much funding do people who came up with a cure for TB have? Or even the people who came up with a cure for malaria, or even came up with a cure for syphilis, or a cure for leprosy? It was just a microscope and a few other things. Even if they don't have machines and equipment and money for vaccines, well, they can be doing combinations. It is actually shameful that it's the American president who is talking about using hydrochloroquine, which is medicine we use for malaria, which they don't have in the US, for slowing down COVID-19. They should be saying, scientists in Kenya have found a combination of aspirin, sijui Zithromax, sijui mitishamba this, mwarobaini this and this, if given to our patients, it is actually helping our patients better or making them live longer as we treat them of COVID-19. It should be coming from Kenya, not from the rest of the world. So I'm urging them, please get up, go to your labs, get your mitishambas, because all these medicines come from mitishamba. Do something. Get a combination for our people who are held in isolation. Let's come up with something from Kenya. Let's not just be consumers. Let us also be innovators with the little we have.
Okay. Are you thinking of funding such a research also in Machakos? Because we've seen Kikotech in Kitui, for example, is dealing with textiles and trying to make masks. Are you doing the same for research in Machakos?
My team is looking at it. We will have a supplementary budget. And my plan is to set up a lab with all the equipment and invite scientists and professors who are serious to come in. We provide for them accommodation, provide for them good working environment. Wachape kazi watupatie treatment.
All right. And at the national level, what changes would you like to see?
Well, I think the national government is doing well. We need to just ensure that the economy is being propped up and that people are obeying what the government directives are. I'm a bit perturbed. We got a letter the other day about how to procure, and from the PPOA, and this is the body that governs procurement in Kenya. And point number one was you cannot procure unless whatever you're procuring is in what you call a procurement plan. So, you know, and we are looking at it. This is an emergency. I mean, Machakos never had a procurement plan for ventilators. Machakos never had a procurement plan for sanitizers. Machakos never had a procurement plan for some of these things that we need or medicines. So our people are still not really thinking critically. We are still, I don't know how to say it. We've not expanded our brain power to think beyond our comfort zones, to say emergency calls for different ways of doing things.
Wouldn't that then land you in problem with the audit queries? Because you've put aside 100 million. If you purchase anything that was not in the plan, and there's that directive that you have to purchase only what was in the plan, wouldn't that raise audit queries then?
Well, that is the problem. And that is what I'm saying here. One day you're saying, Mutua, what are you doing to protect your people? Where do you have ventilators? Do your health workers have masks? Yet we are being told by the body to undertake procurement. You cannot procure unless it is a procurement plan. Who knew COVID-19 was coming? So that's what I'm saying, there's a disconnect. But I hope they have heard me and this will be corrected.
All right. Thank you for making time for us, Dr. Alfred Mutua, the governor.
Asante sana, and let us keep safe. And the whole idea is don't get infected.
All right.
Don't get infected. So protect yourself from infections by keeping away from people and doing what you've been told to do.
All right. Thank you so much.
But we'll defeat COVID-19. I'm very optimistic.
Asante. I share that optimism with you as well, Governor. Thank you for making time for us, Dr. Alfred Mutua.